Hello, this is Dr. Grande. Today's question is, what is avoidant personality disorder? So, avoidant personality disorder is a cluster C personality disorder. That's the anxious, fearful cluster. In that same cluster, we have dependent personality disorder and obsessive-compulsive personality disorder. Avoidant personality disorder, like any personality disorder, is usually thought of as long-lasting and pervasive, meaning it stays around a long time, the symptoms persist, and it affects a number of areas in someone's life. Now, when we look at the symptom criteria for avoidant personality disorder from the DSM, the Diagnostic and Statistical Manual, we see a number of potential symptoms. The first is that an individual avoids an occupation because of a risk of rejection. Someone could avoid a certain line of work because they don't want criticism or rejection. The second symptom criterion is the individual does not want to get in relationships unless there's a certainty that they'll be liked. So again, we see this theme of worrying about criticism and rejection. The third symptom criterion is the individual has difficulty forming intimate relationships. Now, it's important to note with this symptom criterion that a number of people with avoidant personality disorder do want intimate relationships and close friendships. This symptom really refers to the fact that they have difficulty oftentimes with that. It's not about a desire for intimate relationships, but rather the actual ability to form them. The next symptom criterion is a preoccupation with being criticized. Then we have this difficulty in forming new relationships. An individual could have an inhibition when trying to form a new relationship. The next criterion is a feeling of being inept or inferior. So again, when we think of this symptom criterion, and we're talking about a personality disorder, we would think that really most of the time or all the time this is the case. And the last symptom criterion is the individual does not take risks because of fear of embarrassment. So if we look at avoidant personality disorder, we see that somebody would generally isolate because of a fear of criticism and rejection, and possibly because of embarrassment. When we think of this personality disorder, we think there's an excessive monitoring of an individual's internal reactions. So an individual with this disorder is often thinking about how other people are viewing them and thinking about how they could be being criticized or embarrassed or rejected. This excessive monitoring leads to difficulties in forming and maintaining relationships. Avoidant personality disorder has comorbidity with other mental health disorders. And what comorbidity means is it tends to co-occur with other disorders. Now, just because avoidant personality disorder is comorbid with any particular disorder doesn't mean that they'll always appear together. It just means there's an elevated risk that they'll co-occur. So with the comorbid disorders, we have the other personality disorders from cluster C, so dependent and obsessive-compulsive. We also see anxiety disorders, post-traumatic stress disorder, and substance use disorders comorbid with avoidant personality disorder. Probably the disorder that stands out the most as being comorbid is social anxiety disorder. And for a number of people, of course, they have both of these, but sometimes an individual would only have one. But there's a lot of difficulty in differentiating these. With avoidant personality disorder, of course, we think of this as pervasive and persistent. So for example, with the symptom of feeling inept and inferior, somebody with social anxiety disorder would not necessarily feel that way. Social anxiety disorder is triggered by specific stressors in most cases and doesn't really have by itself a general anxiety component to it. Avoidant personality disorder does have more of a general anxiety. Someone's oftentimes monitoring those internal reactions. They're feeling like they could be the object of criticism. Also, with avoidant personality disorder and social anxiety disorder, we see a difference in the level of suspiciousness. An individual with avoidant personality disorder is more likely to look at other people and be suspicious about their motives, like they're targeting them to be rejected or criticized. Whereas somebody with social anxiety disorder is more likely to have insight and see that the disorder itself, the reaction, doesn't seem to match the circumstances. So they see that a particular stressor being connected with panic or anxiety appears to be irrational. So they're frustrated by the symptoms, but they recognize that the trigger is really irrational. Someone with avoidant personality disorder would be less likely to make that connection because of the difference in insight. Now, in terms of the causes of avoidant personality disorder, we think a lot of the contribution comes from genetics. We call this heritability. And there's different estimates of heritability, but it's probably somewhere around 50%. The other 50% would come from what we call environmentability. These are stressors. And we're really not sure what stressors cause avoidant personality disorder, but we have some ideas that early childhood neglect and emotional abuse and trauma seem to play a part in the development of avoidant personality disorder. More so with avoidant personality disorder than we see with social anxiety disorder, panic disorder, or other anxiety disorders. It's important to recognize, of course, that avoidant personality disorder is not actually an anxiety disorder, but it can have anxiety-like features, including panic attacks and a feeling of generalized anxiety. If an individual meets the full criteria for avoidant personality disorder, of course they could still be diagnosed with a number of anxiety disorders, and often are. Now, in terms of treatment, personality disorders are usually treated through talk therapy, like mental health counseling, and avoidant personality disorder is no exception. These therapies have different levels of effectiveness. Some of the more effective treatments would be something like cognitive therapy, rational emotive behavior therapy, or even existential therapy. However, unfortunately, because of the nature of avoidant personality disorder, a number of people that have this disorder don't seek out treatment. Again, this disorder has an isolating component to it that interferes with that. I hope you found this description of avoidant personality disorder to be interesting. Thanks for watching.